Dear viewers, in this video I will be discussing how should we assess patient's readiness to wean from mechanical ventilator. Here I will discuss only clinical criteria. Few weeks back I also discussed weaning predictor, which is different from weaning criteria. Weaning predictor is used when patient meets clinical criteria and still doubt persists over weaning. I am Dr. Sunil Garg from Essentials of Acute Care. Clinical criteria should be used to identify patients who are ready to begin weaning. It is important to understand that up to 30% of the patients who never satisfy such criteria may be successfully weaned. In most cases, the underlying condition that precipitated intubation and mechanical ventilation, irrespective of whether the underlying cause is respiratory or non-respiratory, should be improving as evidenced by clinical, radiological, and/or laboratory parameters. Another important clinical criteria is oxygenation. There should be adequate oxygenation. Thresholds that determine adequate oxygenation are empiric. The reasonable consideration are when either the ratio of arterial oxygen tension to fraction of inspired oxygen, means PF ratio or PO2 FiO2 ratio is 150 or more, or when the saturation is 90% or more while receiving an oxygen of 40% or less and PEEP of 5 or less. Let it understand by an example. If patient is on 40% oxygen, then partial pressure of arterial oxygen should be 60 or more in millimeter of mercury to make PF ratio 150 or more. For patients who have chronic hypoxemia, a PF ratio of 120 or more may be used instead. A higher level of PEEP may be acceptable in some patients to avoid atelectasis. For example, 8 cm of water in patients with obesity or abdominal distension for another reason such as ascites, or patients with a narrow endotracheal tube where the endotracheal tube size is less than 7 cm. Similarly, a slightly higher FiO2 of 0.5 may be acceptable if significant underlying lung disease is present. Another important criteria is arterial pH. Arterial pH should be more than 7.25. Severe acute acid-base disturbances, in particular an acute metabolic, respiratory, or mixed acidosis, should be resolving or estimated to be close to baseline prior to weaning. Although arbitrary, the value of an arterial pH more than 7.25 is reasonable based upon the observation that for most spontaneously breathing patients, it may be tolerated without undue load on the respiratory system. Exceptions exist, including patients with the worsening acid-base disturbances, even if pH is more than 7.25, or patients who cannot generate sufficient MINT ventilation to compensate for acute acidosis, like patients with neuromuscular weakness. Another important criteria is hemodynamic stability. Patients should be hemodynamically stable and there should not be any evidence of myocardial ischemia. The blood pressure threshold below or above which it is unsafe for a patient to wean have not been established. However, it is reasonable to require that the mean arterial pressure be consistently more than 60 and or systolic blood pressure more than 90 and less than 180 mm of mercury, or estimated to be at the patient's baseline. The use of vasopressor during weaning to maintain hemodynamic stability is acceptable, but the dose should be low and stable. For weaning trials to begin, patients should be able to initiate inspiratory efforts. This can be assessed by determining that the patient is breathing above the set respiratory rate on the ventilator. For patients who are breathing at the set rate should be temporarily reduced to a lower value for a brief period and ensure that the patient is able to initiate spontaneous breath above the newly set value. For example, you can set ventilator rate at 6 breaths per minute or 1 minute. There are 3 additional criteria. It is ideal that these criteria are in place but they are less critical to the success of weaning than the required criteria we just discussed. Anemia reduces oxygen carrying capacity and can affect successful weaning. Studies suggest that hemoglobin levels of approximately 7 to 8 gram percent or greater are appropriate target for safe weaning. It is suggested for core temperature to be less than 38.5 degrees centigrade. The rationale for this criteria is that the presence of fever makes successful weaning less likely because it increases the ventilation and thus increases work of breathing. In addition, fever may also result in diminished respiratory muscle function, like in patients with sepsis. However, a temperature threshold above which weaning is unsafe has not been identified. It should be noted that this applies to patients with the actual fever at the time of assessment and does not apply to individuals who are febrile for the periods in between intermittent spiking of fever. Mental status should be clear. It means mental status that is either awake and alert or easily arousable. Although an awake or easily arousable patient is ideal for weaning and more importantly extubation, it is not always feasible due to sedatives or presence of delirium. It has been shown that an abnormal mental status means Richmond agitation sedation scale between -2 to +1 does not appear to be associated with a higher rate of extubation failure. Thus, as long as a patient can protect their airway, an abnormal mental status does not preclude weaning. In terms of role of diaphragmatic ultrasonography, data suggests that diaphragmatic ultrasonography may predict weaning success. However, more robust data are needed before ultrasonography can be used routinely to predict successful weaning. Two parameters were studied to assess weaning. Diaphragmatic excursion means how much excursion occurs during inspiration and expiration, and diaphragmatic thickening flexion or DTF means how much diaphragm thickens when it contracts. The measurement of diaphragmatic excursion are best taken during spontaneous, unsupported breathing. One study reported that the diaphragmatic excursion cutoff value predictive of weaning was 10 mm, while DTF cutoff value predictive of weaning was 21.5%. Here I finish. Thanks for watching this video. If you have any feedback, suggestions or comments, please write down in the comment section. Till then, bye and take care.